Hello everyone. Today we have my favorite topic. This is a tooth completely with calcification. Look internally. How do we go through these walls? And everybody said, oh, it's just a root canal. No, it's not just a root canal. This is a vascular system. And when this vascular system is giving humidity, is giving to the tooth how to defend itself, is giving the strength through the enamel and dentin. And we lose that nerve. And not only that, we start losing the strong structure of the tooth. That is exactly called root resorption. If you see in this image, it's like a mouse who's biting the tooth, correct? So I dedicated since 1995 to start doing research in the Center of Craniofacial Molecular Biology. And with the help of my mentor, Dr. Maggie Zeichner David, I was able to study and get into the journey of obtaining my PhD, passing all the classes, and do the experiments that I wanted to do, which was my passion, root resorption. And until '94, the American Association of Endodontics accepted that it was a disease, but it wasn't a disease until later that we know now more molecular biology. Now we know it's a condition, it can be physiologic, can be pathologic, but it never has decay. It doesn't give us pain. And people in endodontics still think that the tooth cannot be savable. But if anybody tells you, either your dentist or surgeon, whoever you want, you have root resorption, immediately you can Google what is resorption, you can check who take care of the tooth successfully, because unfortunately a lot of our colleagues and friends in dentistry didn't have that push that I was able to learn with Dr. Silva Herzog about what was root resorption. We always knew it was not a disease. It's a physiological movement of the cells of our body. And what cells are that are called odontoblasts and osteoclasts. Guess what? We have internal and external. And the best way that you're gonna know that you have resorption, you have to check. When you have a history of trauma, you fell on the bicycle, you know how easy it is if your teeth came out. If the teeth came out of the mouth completely, what are you gonna do? Place it in milk. It's another topic that we're gonna talk about it. Then they're gonna check the x-ray. This is not painful. Usually you will never have pain. You can have some inflammation of the tooth, maybe not, maybe in front, maybe you have gum disease. Remember I said, you can save so much money when you have your flossing and your brushing before you go to bed. So now, when you think about that, then you're gonna say, what is resorption? Why they are telling me to remove the tooth? So we go through all these diagnoses. This is from a questionnaire that we learned at USC with Dr. Alvarez, the chairman at the time. And we have all these questionnaires that I follow it religiously in my practice. Is questionnaire that all the residents we used to have and make, and our chairman, the PhD in education, was able to teach us how to go through that questionnaire. And absolutely necessary nowadays. Whoever we have the old training, like I was lucky to have with Silva Herzog, and then you come to the new technology. When I went to USC in '92, which was my second specialty, then you realize that we didn't have technology at the time, but now that we have the technology, we're able to visualize what in the past, it was also a teaching from our teachers of histology or embryology. But nowadays, we can see exactly what molecules are triggering. Isn't it fascinating? It's exactly like when people that have osteoporosis, is because the bone remodeling is going very slow. As we age, and also depending if we drink, if we smoke, and we party a lot, we don't sleep well, etc. But that's another topic. We have to enjoy life, really. This is another resorption that if they tell you you're gonna lose a tooth, just send me the x-ray. I can try to talk to your endodontist that I know in all America Latina and also in Europe and countries that speak Spanish. And I tell you with all certainty that we won't find an endodontist that will know how to treat root resorption. So through the research, through my lectures, I have really the luck, I said, to treat this patient. This patient had root resorption, and they told him that he was going to lose not only 1, 2, but the 3 teeth. And I love when I call him to come. Every time I get a lecture, I have to call him and come running, and he's adorable, a PhD in political science, very intelligent man. When I remove the material, look what happened. So what is next after this? Well, what is he gonna do? It's very little to the structure. Well, that's what we're thinking, because he never wanted to have a CT scan. If we have done a CT scan at that time, that it was 2012, I would have seen that it was an internal resorption, and I was more confident. But really, with the people that have the luck to have the old-timer knowledge, I advise the residents, don't never lose the basics of endodontics. Don't jump to technology, because technology is gonna be as good as your hands are gonna be, and your brain is gonna work, and your knowledge that you have. You can have the best technology, but if you don't use your knowledge biologically, you're not gonna understand the cells as much. So in this situation, I saw the CT scan. I didn't see the CT scan, but I saw when I opened with a microscope that there was no blood, it was no connection with the external area, and I was able to treat the patient in this way. And until now, he's extremely happy. I never charge for my follow-ups in my office, because I'm very, very picky. I need to know the patient is gonna come through the year. So in 2021, this is the last time he came, and I have 2022. He's still with his teeth, he's very happy, he has no problems, it has no change, but now he wanted to have a CT scan. All of a sudden, he came with the idea of the CT scan. We were very lucky to know that it was an internal resorption. So in this case, this is gonna be boring for you guys, but this is what I get just fascinated now, that you can have a CT scan and you see like pieces and pieces, and where is the resorption coming, where is exactly, what is the shape. And it's just fascinating. I'm so lucky that I have access to this technology. If you have the resorption like this, it's a little, you almost don't see it, right? And then you have a big infection. This is a coincidence, but this is not caused by the resorption, so don't let anyone touch your tooth. Immediately tell them that you're gonna send me the x-ray, because they cannot take your tooth out. I will be happy to talk to your endodonts in any part of the world that you can be. I have one time an endodontist calling me from Saudi Arabia, sent me an amazing, strong man, and successfully we did the diagnosis. I can help you with FaceTime or comments. But in this case, this is an internal. You see this shadow? They can also tell you, oh my God, you're gonna lose a tooth. And you believe it, and you lose a tooth, and then you need an implant. And we will never have the same. The tooth is the most valuable thing that we can have. We can hardly reproduce it. We have reproduced the coronal part. They are doing now many studies. Dr. George Wan, a very close friend of mine, is studying stem cells. USC since Dr. Slavky, like 40, 50 years ago. So, and Dr. Sainek David. So as many people studying all the cells of the regeneration for a long time ago. But nowadays, looking at this is an external resorption. And they're gonna say, well, we're not gonna be able to do a crown. Luckily, I work with Dr. Vijak, who did a repair here on the resorption. I like to use Gerrestore, but he used another type of ionomer of this cement, this composite. So now he does a crown, and look at 2022. You know, the crown was finished, and then I was just amazed, and the patient is very happy. And now we have here for last, I tell you, this is an internal resorption. We have to use MTA, but in this case, it was just only calcium hydroxide, and this case is working for more than 26 years. Now it's 27. Now, what I'm gonna tell you to go to an endodontist, don't let them take your tooth out. And the way we have worked in other cases is this way. And Dr. Simon and I and Dr. Hapasolo, we do videos of our cases, and we love to send them to Dr. Hapasolo, who puts this together for the students. But I told Dr. Hapasolo, Marquitos, if you're listening to me, that I use it a lot for my patients. And my patients love your videos. If you want to learn about dentistry, people that want to go to dental school, you can buy this CD of Dr. Marcos Hapasalo, or ask questions and make a comments, subscribe to YouTube, follow me on Instagram. But this is a way that we're cleaning a tooth, but this tooth was destroyed. It was very destroyed. So don't focus on that. Focus on that. You're not gonna see a hole in front of you, but we're gonna see all the end canal. On top of it, right there, we have the instruments now. We have imagine the visibility that we can have now with the help of the microscope. And the old times we were doing this, but everything was with the more measurements than now. Everything now is more easy to obtain because the way we have the big visibility now. We don't have excuse to have a failure. However, you will see it sometimes if the patient is grinding. Remember, they're gonna need a night guard. We're gonna talk in another chapter about night guards. But from now on, just remember, internal and external root resorption can be repaired. I tell you that for more than 20 years that I've been treating this. And this is a material MTA that we use another ones. And this regenerates certain cells on the body that we're going to protect all the root from having a resorption again. But if you have braces again, if you are clenching, grinding your teeth, and putting together this way, guess what's going to happen? You're going to create destruction, and eventually you're going to start having resorption. It can be on the cervical area of your teeth, it's right there on the neck of the tooth, or it can be all the way on the root. The simpler, the easier that is to accomplish root resorption. So for now, I wanted to thank you. And if you have comments, please subscribe, follow us on Instagram. Thank you very much.